Hi, my name is Aya Soyer. I'm a senior, public health major, dependent of the Navy. My hometown is Temecula, California. I participated in the UCLA Global Health Internship program. I spent 2 months in La Paz, Bolivia. I was doing clinical shadowing in various hospitals and centers there and taking classes for medical Spanish. I learned about this program through a mutual friend, but if you look at the UCLA IEO website, they have a bunch of different internships in many different countries and specialty areas. I wanted to participate in this program because I was interested in medicine and wanted to gain more shadowing experience in hospitals. This opportunity gave me a chance to improve my Spanish and also expose me more to the medical field. Yes, so most of the program is in Spanish. That's the goal of the program. So part of the interview process is a short Spanish interview to gauge your cognition level. And we had a class that focused on teaching us medical terms in Spanish. All the hospitals and the staff, of course, mostly only speak Spanish. And our public health courses were given by our medical director in Spanish as well. I want to become a women's health physician and focus on OBGYN, and I want to also go into public health research. I think it was really amazing to spend time in a hospital as I had never really gotten to do that before. It really showed me that I do really want to go into medicine. It was amazing seeing the compassion that the providers were able to offer their patients and making people feel comfortable when they're going through times of health issues. And I think it's a great experience if you aren't necessarily sure about medicine and you want to get more experience to see if you really do enjoy it. 3 takeaways is that I definitely was able to improve my Spanish. I think the best way to learn a new language is to really immerse yourself in it, and having to use Spanish every day and hear people talking, it really gives you the opportunity to improve your Spanish. And another thing I really learned is that I for sure want to go into medicine. I think it's super important to spend time with physicians and patients to really see if you could see yourself working in that environment. And I really loved it and realized I for sure want to do it. A third thing was that this program allows you to go into many different specialties. You go to a new hospital every week. So I got to spend time in a women's hospital, pediatrics, primary care, and I was able to really see that I'm interested in women's health. The one thing I would definitely say that made it a little bit difficult is it being 2 months long. If you know that you're a person who gets really homesick really easily, it might be difficult. I think for me, after the first month, I started to really miss home and miss my friends and family, but I knew that the experience was worth it. So it still paid off in the end for me. I think it was a huge part of strengthening my application process. It's one thing that medical schools like to see is you spending time in hospital environments so that they know you are for sure that you want to be a doctor and that you've done the work to really see what that life could look like. So I was able to really talk about being in the hospital, seeing patients, talking with people, now knowing another language, which makes you even more of an asset to a hospital that might be in somewhere like California where there's so many Spanish speakers. So I think it's super important if you don't necessarily have the shadowing experiences that you want to have, and it's really helpful. Actually just got my first acceptance today. I've taken the MCAT, I've done all my applications, and now I'm in the interviewing process. So if you have any questions about that, you can reach out to me and the Veterans in Healthcare program. Number one advice is take a test first, take a diagnostic test to see what your strengths and weaknesses are. I think it's really hard when you think you need to learn everything, but you tend to forget the things that you may already know. So take a test, see what categories you really need to focus on so that you don't spend so much time on stuff you already know. I really decided that I wanted to go into healthcare my sophomore year of high school. I did go shadow in a primary care office, which just ties back to how important shadowing is. I feel like it's easy to think you like something until you really live it. So I knew after that that I wanted to go into medicine. I got lucky in the fact that I have a lot of healthcare people in my family and in my family friends. So I was able to get in contact with a doctor in the area and give him my resume. So I recommend if you're interested in shadowing locally, just send emails, send your resume, and you never know what could happen. Shout out to my mom and dad. I know I wouldn't have made it this far without you guys and your support.